start the recording. So thank you all. Thank you, everybody. Welcome. Thank you so much for joining us. I know it's a very busy time of year and life just never seems to slow down. We really appreciate you coming together with us for this regional forum on health equity. And we've got some really great stuff that's lined up for tonight's program. My name is Sarah Raitt, and I'm going to go ahead and share screen here, see if I can get this. Okay. And Megan, can I ask you to confirm, can you see that full screen now?
You're good now, yeah.
Awesome, thank you. My name is Sarah Raitt, and I'm here with my colleague, Megan Asbury. We're from Two Rivers Ottaquechee Regional Commission. And for those of you who don't know our office, we're a regional planning commission that serves 30 towns in East Central Vermont. So we help out with a great variety of projects, everything from land use and energy to housing and health, which brings us all together this evening, and a whole lot more. So we do a whole bunch of stuff in our communities, and you can see a map of our service area on the right-hand side of your screen. All of us live on unceded Abenaki and Wabanaki lands, and this landscape has been profoundly shaped by 4 centuries of past and ongoing injustices. In the course of tonight's forum, we're going to have a mixture of presentation and open discussion. So when we come to the open discussion sections, we really hope that you'll chime in by using the raise hand function on your screen. You should be able to find it at the reactions button at the bottom of your screen, or just sort of wave at us, wave your hand at us, and we'll do our best. If you have your camera on, we'll do our best to keep an eye out for you. And when you're not speaking, please do keep yourself muted to help reduce background noise so we can hear everybody who wants to chime in. So this is the, there we go. This is the roadmap for this evening. We're going to start with a quick overview of what we're talking about so that we're all on the same page. And then we're going to, then we'd love to hear your reflections about health equity challenges in our region. And then after that, we'll turn to a discussion about what we can do to tackle these challenges. We're going to give a quick overview of how we're thinking about planning's role in that process of tackling health equity challenges. And we're also going to introduce a number of resources that are available to support health equity projects in our region. And then finally, we're going to close out with a group conversation about the projects that you're currently working on, or projects that you'd like to get started, so that we can learn from each other's experience and support each other in making connections to allies and resources. I'm going to take another quick look here at the waiting room. Looks like we've got everybody. Thanks so much for those of you who joined us a little bit late. We're so happy to have you. We're just getting started here and diving in. So before we can talk about health equity, it's important that for us to reach a common understanding about what health is. And sometimes I think we limit our thinking about health to just our physical state and how our body's doing and maybe what those numbers from the doctor mean. But health is also inextricably bound up with our quality of life, with our well-being. And we know that there are a great many factors that influence our well-being. And when we're struggling in those areas, we see impacts on our physical health as well. So for that reason, health professionals talk a lot about the social determinants of health, or in other words, the ways that our surroundings and our relationships and the other conditions of our lives influence our health outcomes. And these are some of the most important: social and community context, our economic stability, our neighborhood and our built environment, our access to healthcare and the quality of that care, and our access to education and the quality of that education. There are certainly more, but these are some of the biggest ones. So what does equity have to do with health? When we look honestly and carefully at all the conditions that influence our well-being, all those social determinants of health that we were just talking about, we see that not everybody has the same access to the resources and the power that they need to thrive. So we can imagine, for example, two people who are heading down the same village street. Those two people can experience that street in very different ways. Maybe one of them is in a wheelchair, and that hole in the sidewalk is a bigger challenge than it would be for somebody who is able to just skip right over that hole, right? Maybe one of those people gets treated in nasty ways by the passersby who, because they look different or they live differently from most of the people in the village, so much so that they don't feel safe traveling through their own town. And they carry that stress with them every time they leave their house. Whereas that other person who's moving down the street and doesn't have to worry about how others are going to react to them, doesn't have to worry about being ostracized in the million subtle and often unspoken ways that people can make each other feel unaccepted and unwelcome. So that person has the privilege of being able to focus solely on ticking the errands off of their to-do list. Those two people have very different experiences moving through the exact same landscape, and there are very real consequences for their health and their well-being. So we're not starting out on an even playing field. The unevenness is driven by history, which, as we all know, casts a very long shadow across the generations. It's also driven by the systems that we set up and we depend on every day, many of which perpetuate inequalities and continue to make that playing field more and more uneven. And as many of you know, the distinction between equity and equality is the recognition that we need to meet people where they're at, and that people need different kinds of support in order to thrive. And a one-size-fits-all solution, in other words, providing, for example, expecting to provide one service that benefits everybody or everybody benefits from in the exact same way, that simply doesn't work. So we can define health equity as the state in which everyone has a fair and just opportunity to attain their highest level of health. And conversely, health inequities are patterns of differences in health outcomes between groups of people. And those differences are driven by inequities in how resources, opportunities, wealth, and power are distributed within our communities and then also across our communities. When we look under a microscope, we see how individual experiences make up these patterns. But when we step back and we look at the big picture and we see the forest, not just the trees, we can see that certain groups of people are having a harder time than others in attaining their highest level of health. And some examples of those groups include, certainly are not limited to, Black, Indigenous, and people of color, people with disabilities, LGBTQIA+ communities, refugees, those who are English language learners, people who are unhoused, people living in very rural areas, and the list goes on. When we look at the Vermont State Health Assessment data, we can start to get a picture of some of those inequities, although it's a very incomplete picture. Those data tell us that BIPOC folks are less likely to have a primary care provider compared to white non-Hispanic people. Adults who are Native American or Alaska Native and adults who are multiracial are more likely to report fair or poor general health compared to those of other races and ethnicities. They're also more likely to be diagnosed with depression. BIPOC high schoolers report having fewer social supports compared to white non-Hispanic students in Vermont. LGBTQIA+ adults are twice as likely as heterosexual adults to delay medical care or to be unable to get their care due to cost. LGBTQI adults and youth also experience higher rates of depression and intimate partner abuse and sexual violence. Adults who have any kind of disability are nearly 7 times more likely to report fair or poor general health and to be diagnosed with depression compared to those who do not have a disability. And when we look at income, low-income folks are less likely to have a primary care provider, and they're more likely to struggle with poor mental health compared to those who have higher income. So that's just a brief snapshot of some of the challenges that we're dealing with. Last summer, all of the regional planning commissions across the state were asked to distribute a health equity needs assessment survey to our municipal leaders. And when we asked what they thought the biggest barriers were to health equity in their communities, they called out the lack of various resources. And these were the themes that emerged. And you can see that they're very wide ranging. They really touch on all the different social determinants of health. And it's certainly not a complete list, but it does give us a sense of just the diversity of challenges that we're facing in our small communities here in East Central Vermont. So at this point, I'd like to open up the floor and ask for your input and to share your wisdom and knowledge. There's so much wisdom and knowledge on the call this evening. I'm so excited to have you all here. And to get your thoughts on the barriers that you see to health equity in your communities, where you live or you work, in the region as a whole, if you're working more broadly. And to think about the support systems that we currently have and where are the gaps and why do you think those gaps exist? So I'm going to stop sharing my screen here so that we can all see each other. And we'll take just about 15 minutes or so to talk through this. Does anybody have any thoughts they'd like to share?
Hi, my name is Dina. I'm here representing the Sharon Health Initiative. So we're sort of based off like a town nurse model. I'm not a nurse, I'm actually an OT, an occupational therapist. But I think that this is a model that addresses a lot of the social determinants of health. It's a free service provided to residents of Sharon. And we really just meet them where they're at. I mean, actually in their home, but also whatever goals they have, what are their health needs, health literacy, do a lot with like continuity of care, a lot of resource connection, transportation, food insecurity, all that sort of stuff. So just to address like a possible solution, I know that this has been kind of creeping up out of the Upper Valley, and a lot of towns are now around me have a similar program, and I think it's a great model that I wish more towns would adopt.
Thank you, Dina.
Thanks.
There's I think I saw you coming off mute there. Did you want to say something? Oh, Nizoni, did you want to chime in?
No, I think Jeffrey had put his hand up before I
Okay.
did.
Hi, Jeffrey. Oh no, we're having trouble hearing you. Oh, I cannot hear. I'm going to ask you to unmute real quick.
It might be something with his headphones.
Yeah, it's very possible. Jeffrey, are you able to take the headphones, to unplug the headphones? Can you unplug them from your computer? We're still having trouble. I'm so sorry.
You can use the chat instead.
So if I may just take 30 seconds to walk them through something.
Yeah.
Jeffrey, hi, my name is Nizoni. If the bottom of your screen you see a microphone and it will say mute and unmute, there's a little like caret right next to it. If you hit that, it allows for you to select your microphone so that you can listen on your headphones while your computer will select the proper equipment for you to speak so we can hear you.
Thank you. It's so
Still can't hear you, but right on that, it's like a little triangle-y kind of thing. If you click on that, it will say select microphone or select speaker, and it lets you choose independently. Yep, and now you can hit the mute button. So you hit the mute button, Jeffrey. You want to hit it again so that the mute button comes off.
Sorry, you can also unmute him as
Yep. I just asked again. Oh, no. Okay. We're still struggling. I'm sorry. We still can't hear you. Jeffrey, would you be willing to type into the chat box the comment that you wanted to make? I'm so sorry. This is really frustrating. Okay, Rudy, well, actually, Nizoni, I wanted to go to you first. Did you have something you wanted to chime in with?
I just out of the list, I had noticed two, which always pop to the top of my mind, which are childcare and housing. Those are kind of like some really basic needs that, when they're left unmet, tend to take away from the other portions of our life that we would like to be able to spend more time and energy on. And I'm wondering, there's a lot of programs right now to help folks with starting businesses, especially looking at BIPOC folks who are wanting to start businesses. And I'm just wondering, since there's such a need for childcare, if there are people out there that want to start some sort of childcare program, or even, in conversation today, even with folks looking at the lack of childcare at hours that are needed. Everything shuts down so early in our communities, but having childcare accessible for those second and third shift workers as well was just something that popped into my head. That's all.
Absolutely. That's so important, and we struggle with that so much in our region. I know that they're doing some really exciting work around childcare in the Randolph area. I'm not so familiar with childcare efforts like closer to the river here, the Connecticut River. If folks have anything to share about that, that would be great. Rudy, I see your hands up.
Yeah. Hi, everyone. I work for the Department of Health, and Dina just made me think of one of the problems that I feel like we have is bringing solutions to scale. We have a lot of good efforts. I mean, Dina's doing great things in the Sharon town. Those great things should be happening in all our towns, and it's hard for us to apply sort of a universal solution to some of these things. You'll hear about transportation, where one particular community will have a program with a sufficient number of volunteers, and another area of the region is sort of underserved. And it's just, how do we bring some of these solutions that we know will work to scale so that they reach everyone? And I think that's a real challenge to this work, to all the work of public health.
Thank you, Rudy. Absolutely. Nicholas, do you want to chime in?
Yeah, hi all. I work at the Rutland Regional Planning Commission, and I just wanted to say, I don't have their names up anymore, but the last two comments were really helpful because, I've been kind of scratching my head about, with the funding that we have, what can we do that would be applicable across the region in some of these areas that we know are like just multiplicative in terms of their effect on working families and stuff like that. And I love the idea of, providing some small funding for those who want to start a business, whether it be in home building or childcare. So I was wondering if anybody had heard anything about, using funding to have a fund for business strategy consultation, or just a startup fund or anything like that for childcare. I don't know. It's exciting stuff. Yeah.
Nizoni, did you want to respond directly to that comment? And then Alice, will turn to you.
Yes, I did. Have a seat. Sorry, kids just walked in.
It's okay.
So the Small Business Association is doing a pilot navigation program that I know is accessible on both sides of the river. And I had been connected with them, and in particularly, one of the things that was talked about was childcare and focusing on helping those who wanted to develop some sort of childcare program. Specifically, what they were speaking to was BIPOC folks that wanted to start up some programming. There's a real lack. There's funding available and resources available, but there's a real lack of people to help navigate through to develop these programs. So I would say there's definitely a want or desire to like connect with people who are interested, but a lack of knowing who the people are, right? And in the meeting that I went to, there were two people who had spoken to starting some sort of childcare business. And I think actually, Dina, yes, Let's Grow Kids was one of those resources that was mentioned. But connecting with the folks over with the SBA, and I am more than happy to do like an introduction email if you want to have that happen. Oh, you're muted.
Sorry, I got a new computer and the taskbar hides the mute, but anyway. Yeah, that'd be great. If you could drop your email in the chat, I'll shoot you something. Yeah,
Absolutely.
thanks.
So exciting to hear resources being shared, because that's why we wanted to bring everybody together tonight. Thank you, because we don't all individually have the answers, but together we do. Alice, did you want to say something?
Yeah, I had actually two things. One of them was about the transportation issue. I was in a really interesting meeting at Vital Communities probably about 8 or so years ago, where we all talked about the fact that the way that people get to medical appointments and things like that, if they can't drive, is generally older volunteers, and that as our population ages, to put it bluntly, we're eventually going to run out of older people to drive the even older people to the doctor's appointments. Like, it's not a sustainable model, and it really, really needs to be addressed. And we talked about the idea of maybe, especially the smaller towns, maybe grouping together and having a town driver. You know, you'd have dispatch and a driver. That hasn't ever happened, but Windsor is now doing this micro move pilot, where it's the mover, and it's like this little kind of minibus that's handicapped accessible, that just, it's an on-demand resource, and it drives all over Windsor, just Windsor, the town, picking up people and taking them to other places in Windsor. And it's been, I talked to a woman the other day who was waiting for the person she was with to get loaded onto the van, and she was just raving about how it had just changed things and made things so much easier for them, because the person she was bringing to the medical appointment was not, is wheelchair bound, and she just wasn't really able to get them in and out of the car. And so having the van and the driver and all that like really changed that dynamic. So I'm hoping other things like that will happen. I also want to make a comment about advanced transit and the other public transportation that we do have in the Upper Valley. It tends to be organized around taking people to jobs at Dartmouth College and Dartmouth Hitchcock. And if you are somebody who works anywhere else with hours that don't start at 8 a.m. in the morning, it does not work for you. And some of those feeder lines come through the outlying towns and pick people up too early for them to drop their children at school. So they literally can't take the bus because they have no place to put their kids because the bus comes through too early. So that's like a pet peeve I've had for years. And then I just want to throw out one more thing about the second and third shift. It's not just childcare, it's everything. We had a focus group recently around our food security work, and one of the people brought up that her friends can't ever go to the food shelf because the food shelf's not open when they get off work. And so great suggestion that Megan and I got from a person with the Department of Health about the idea of maybe you could recruit third shift workers to volunteer at a food shelf to provide food shelf hours for third shift workers. I think it's a great idea. We haven't really gone anywhere with it yet, but I just kind of wanted to put that out there, that there's always kind of this thing, well, like, nobody wants to stay late, nobody can do this, but if you could get volunteers from the population to serve the population, then maybe some of these things that don't seem to make sense do make sense. So that was a lot of comments, sorry.
Thank you, Alice. All so helpful. Jeffrey, you want to try again? Let's try this again. We still can't hear you. I'm so sorry. Very frustrating. I'm curious if I can't hear you now, unfortunately. I'm so sorry. Yeah, I know. It's really hard. Maybe you could, if you have a different like computer or some other like a piece of equipment that it has worked on in the past, you could sign off and then sign on again. Also, Jeffrey, you can also drop your comments into the meeting chat. So you can, on the bottom of your screen, there's a little button that says chat. You may have to go under the 3 little dots that says more on the right-hand bottom of your corner of your screen, click on that, and then there's a little, in the menu, it says chat. You can type comments into the chat to everybody, and that way we'll be able to interact with you. And I see Alice made a comment in the chat too, building off of what Nizoni had discussed. One challenge is the sustainability of technical support and funding efforts. We need more of those over, a continuous period of time. Sorry, I did see another hand, but I think I've lost it. Dina, are you still with us? Oh, you're on mute, Dina.
Thanks. I just was wondering about how the Windsor, the bus that's being trialed, what the funding is for that. Thanks.
Alice, did you want to respond?
Yeah, I have to be honest, I don't know for sure. I believe that Amanda Jordan Smith, who is the lead person at Volunteers in Action, is the one that negotiated the deal. And I can certainly find out, but I'm pretty sure they got a grant that is funding it because it is a pilot program. They've been testing it for a few months now, and I think it's for 1 year.
What was the name, Alice?
It's called the Micro Move because the mover is like it's like a sort of Southern Windsor County transport service, and they have and they do actually have like a regular sized bus. This is like this little tiny bus. I'll see if I can grab some information about it. I might have seen something in one of the town manager's newsletters that explains it better, and I apologize that I can't explain it.
Thank you, Alice. I just saw a really good suggestion from Katie in the chat that Jeffrey, maybe if we can't get the computer audio to work, you could try calling in. And I've just in the chat function, I've just dropped in the phone number that you can call. And once you call that phone number, it'll ask you for a meeting ID. And that's the meeting ID that you'll enter right there. So that's another way that we can try to get you in for audio. I'm so sorry you're going through that. That's really frustrating.
One more thing, if I could, just real quick before we move on.
Please.
Volunteers. What I'm noticing in this role as like a community health worker is that, again, sort of the local organizations that are taking it upon themselves to form these sort of loose coalitions to brainstorm what to do. Like, for example, I sit in with Gifford's community health team and social work and like the SASH area agency on nursing, and we all just kind of brainstorm how we can help with the major problem right now, which is delayed home health admissions. So folks are going back to the hospital. And then like the Upper Valley volunteer coordinators, just anyone who works at any type of nonprofit who works with volunteers, we sort of, again, form this loose coalition, and we meet almost monthly to share ideas, share resources, share volunteers, just to kind of, again, work around what Alice was saying about, like, most of our volunteers are 70 plus. Yeah. Thanks.
Absolutely. Thank you. Other comments, things that folks have noticed in your work around health equity challenges in our communities? Maybe problems you haven't found a solution to yet, or problems you're working on finding a solution to. Alice, hey.
In the work that I'm doing, one of the things that I think is very much a challenge, and you were able to talk about some pieces of data that describe what's going on for people of color or people LGBTQIA+. However, in some of the work that we've done over the last year or so, in digging into the data that's available for people of color or the data that's available for LGBTQIA+ is incredibly limited. So one of the things that I'm really concerned about, and Alice Ely from the Public Health Council, if folks don't know me, is, are we saying that these are problems for people of color or LGBTQIA+ because it's the only data that's available? Or do we really understand what other things people in those communities would tell us are their greatest concerns? You know, if you have data on 5 things, but there's 25 things you don't have data on, it's really important to be clear that you only have a small piece of the picture. When we did some work to reach out to people in the community who were BIPOC or LGBTQIA+, the question was, what is it people are telling you they're most concerned about? And it came down to questions of mental health and substance misuse, but rooted in a place of not feeling welcome in a community, feeling marginalized, feeling discriminated against, feeling afraid, feeling isolated. And so when you talk about the social determinants of health, it's really important to keep coming back farther and farther to say what's really driving this. So I definitely want to put on the table that we have people in our community who are very valuable parts of our community who don't really feel welcome in our community. And that's a problem that needs to be solved on every level. And it does include the municipal level, setting expectations of how we treat our neighbors and how welcoming we are to them. I could go on, but I won't. Thank you.
Alice. Yeah, it's absolutely critical that we are building the relationships on the ground in our communities and doing the work of challenging the prejudices in our communities and the systemic inequities, and really trying to figure out how people's experiences are being lived out in our communities. Looks like Jeffrey is trying to get a hold of us here. I'm hoping that the phone will work. I am not seeing. Oh, okay, he's in the waiting room. Yes, okay. All right. Jeffrey, can you hear us?
Hello, hi.
Hi. Oh my goodness, yay, this is so exciting. It's so good to hear your voice.
Yeah.
Thank you for being with us. What did you want to share with us?
Thank you so much. And I apologize, but can I just tell you one of the things that is really so important and why it was important for me to come? In Heartland, we are looking at this incredible thing. If you look at the New England Journal of Medicine, that issues related to aloneness have been very critical in allowing people to fail from not only from psychiatric issues, but from other medical issues. And we're putting together a program using our community nurses to really concentrate on issues related to aloneness in frail elderly people, and to reiterate, this is something that we are planning to work on. And it was so important. I feel so bad I couldn't make contact. So I'm going to stop there, but let you know that we are using our Aging in Heartland community nurses to really make a major contact with that frail people. And one of the things we're doing is we're seeing that will help to stop where people will call EMS for something that really is not necessarily medical. So I'll stop there, but I just wanted to make sure that I pass that on and to reiterate that this is something that we are going to spend the rest of the year using Aging in Heartland to do this. So thank you so much for bearing with me about allowing me to make this contact.
Absolutely. And that's so inspiring to hear that that's the work that y'all are doing in Heartland right now. And toward the end of this meeting, we're going to really dig into the projects that we've all got going and how we can support each other. And so think, Jeffrey, if there's resources that you need, or if there's questions that you have about that work, or there's another project, and we're going to dive into that more towards the end of the meeting.
Thank you.
Thank you. All right. So at this point, I think I'm going to head back to our presentation here. And Megan, can you tell me if that's coming up full screen for you? Awesome. Thank you. So here we go. Where do we go from here? How do we tackle the health inequities in our communities and across our region? And we've already started talking about some of the work that's already underway, and we've got so many incredible actors around our region who are doing fantastic projects. We know from the conversations that are happening in our communities right now, and the conversations that are happening nationally about the social determinants of health, that we need to tackle these challenges on many fronts simultaneously. And there are so many different ways that we can influence these driving factors. So that means that there's really a role for everybody in the work that's ahead of us. Megan and I approach health equity through the lens of planning. So we focus a lot on the neighborhood and the built environment. But as we all know, our physical environment is deeply interconnected to how the economy is doing, to the availability and accessibility of services, and the extent to which people feel like they belong in their communities. So as planners, we have many opportunities to indirectly impact health outcomes for our communities by making improvements in all of these social determinants of health. We're going to talk a little bit, very briefly, about the contribution that planners can make and some resources to help those who want to get involved in the planning side of health equity. And then we're going to open up the floor to all of you, like I had mentioned, because you bring such a great diversity of perspectives and experience, and you're approaching health equity from many different angles. So we're trying to make this as much about resource sharing as possible. So this is a very quick bird's eye view of how the principles that we hold to be good planning practice line up with the social determinants of health. And I'm not going to dive into these in any great detail, but I just wanted to pull out some highlights, which is that as planners, we do a lot of work to promote the development of compact, mixed-use village centers in downtowns where people can live and work and access services. They're not having to drive 45 minutes to get to a job. They're not having to drive 45 minutes to get to a doctor. We try to focus on modes of transportation that are not car-centric, right? So transit and bicycle infrastructure and pedestrian infrastructure to get people moving, and the health impact, we all know the health benefits of that, but also to get them out in their communities and interacting with other people. There's social benefits that come from that, and making sure that folks can access jobs and services even if they don't have a car. Likewise, making sure that our communities are accessible to those with disabilities, making sure that our recreational facilities and public outdoor spaces are accessible to those with disabilities, to those who don't have a car. Also community gardens, and this is something that's going to come up as Megan's talking about food justice a little bit later. Community gardens are a growing part of the conversation about planning in our communities because we know that they tick the box down the line, right? So we know that they're good for getting people moving and active. We know that they are good for improving social connectedness. We know that they're great for making a sustainable source of local healthy food that people can access, again, without necessarily needing to get in their car and go to a grocery store somewhere, which may not be anywhere close to your community. And then also thinking too about, making sure that we have affordable housing. That was something that was brought up earlier in the conversation, that it's so important that folks are not breaking their bank with every rent check that they're paying every month, right? Because that has ripple effects for the rest of their well-being. Oh, and I should also mention too, I apologize. So from a process perspective, right, participatory planning processes that bring diverse voices to the table and empower them to meaningfully impact policy are critical for the success of planning projects. And that empowerment also benefits social connectedness. So again, it relates all back to those social determinants of health. So if you're interested in learning more about how planning relates to health equity, you can check out a new toolkit that was just developed by the Lamoille County Planning Commission with input from other regional planning commissions around the state. And it includes sort of a deeper dive into how built environments relates to health issues. And it also includes sample language for town plans and bylaws, which can be helpful to planning commissions as they're working through those documents. And it includes a collection of resources and case studies for inspiration in the work that we all do, which we can always use more of. You can find, oh, I apologize. So you can find the toolkit on Lamoille County Planning Commission's website, which you can see right in the upper right-hand corner of your screen there. We've also included the link in a resource guide that we're going to share very soon here, a little bit later on in the presentation. And so at this point, I'm going to pass it off to my colleague and friend, Megan, who's going to talk about food security planning work that we've been doing at Two Rivers. And Megan, just tell me when you need me to advance the slides.
Okay, great. Everyone can hear me okay? Okay, let me scroll back in my notes. So again, my name is Megan Asbury and I'm a planner with Two Rivers. I'm mainly focused on economic development and creative economy support, as well as food security. So I'm very briefly going to introduce you all to another health and food security project that Two Rivers is a partner and facilitator on. It's the Community Health Improvement Plan, which is otherwise known as CHIP, Regional Food Security Assessment. And fortunately, Alice Stewart with Mount Scottney Hospital and Health Center's Community Health Department and a key leader on this project is all online. So Alice, if you want to add anything while I'm talking, please chime in. So it's important to note that this is not a public facing project in the sense that it's not meant for the general public to use to find food security resources. And I'll reiterate this later, but it is meant for community partners such as yourselves to visualize where gaps are in our communities and to brainstorm opportunities to address them. So there's an effort among regional partners, including Mount Scottney Hospital and Health Center, the Windsor Community Food Shelf, Two Rivers Ottaquechee Regional Commission, Mount Scottney Regional Commission, and so on, to assess food security in this region. And the CHIP Food Security Work Group is one of 6 collective impact work groups that responded to the Regional Community Health Needs Assessment. And you can visit Mount Scottney Hospital's website for more information on that. And it's conducted by the hospital every 3 years. So this multi-sector work group, which is co-chaired by the Windsor Community Food Shelf and Mount Scottney Hospital and Health Center, is working to increase access to nourishing food for all people in our communities. So on the left of the slide, you see the CHIP project service area. So the towns in this project include Barnard, Pomfret, Hartford, Bridgewater, Woodstock, Heartland, Plymouth, Reading, West Windsor, Windsor, and Wethersfield. You can go to the next slide. So getting into the purpose and the background, this is really all about assets and gaps. So the assessment defines assets as places and programs that supply food for purchase or without charge. And the purpose of this plan is to inform decision-making, planning, programming, and policy tools to better connect underserved residents to food security assets. So this plan allows us to catalyze planning integration and policy prioritization, to raise awareness and support stakeholders in the community, to create new economic opportunities while overcoming barriers, and to assist and strengthen applications for funding. And the methodology that was used in this process was a comprehensive inventory of food assets region-wide, including access points and program participation by those access points. And this inventory was reviewed by context experts in each town to verify completeness. There was data that was gathered about participation rates across benefit programs, which is things like WIC or 3 Squares, and analysis, including ArcGIS mapping to identify gaps, barriers, and opportunities to increase equitable access to food across geographies and demographic groups. And then finally, vetting and validation of the action plan initiatives with people who are impacted by food security via a convenience sampling survey. And this was disseminated through partner organizations, including food shelves, schools, medical facilities, and social service providers. And then it was further explored via focus groups before finalizing the plan. You can go to the next slide. So what's really important also is that the map and the framework plan are not yet finished. We are still in process, but I just wanted to provide a snapshot of the work that we're doing. So this is a screenshot of the map from ArcGIS Online. I have it zoomed into the Hartford School District, and the scattered colored dots that you see represent food access sites. So these include places like schools, food shelves, and stores that accept food programs like 3 Squares and WIC, as well as shops that don't. So we can't engage with this right now because it's just a screenshot and not the actual ArcGIS. But in the map, you can click on the dots to see if it's a school, what program it has, or a store if it takes WIC or if it doesn't. And I'm not sure how your Zooms are set up right now, but if you're like the pictures of everyone who's in the meeting, if that's covering the right side of your screen, there's a whole bunch of little dots in Hartford that are all on the edge. And it just kind of illustrates that even in one of our most populated towns, access to resources is scattered, and that can greatly impact folks that have limited mobility. So this map is informing this framework action plan to address the gaps to better serve community members. Next slide. So intended audience. Again, the intended audience and users of the map and the action plan when complete include municipal and regional planners, community organizers, healthcare workers, town managers, nonprofits, funders, and other stakeholders. It is not meant for the general public to use to find food security resources. It is meant to visualize the data so that we as community partners can see where gaps and opportunities are in the region and where to address them. So the goal of this whole thing is to increase education and awareness of this ubiquitous issue in the region and lead initiatives to create change. The final product is going to include the action framework plan, an executive summary, and the food asset map on ArcGIS Online. And so while the food security work group has taken the lead on several initiatives, we are still actively seeking additional stakeholders to join these efforts, either parallel to our work or in conjunction with this work. And the comments that we've already heard in the last hour are really vital for developing this framework. So Dina mentioned the community nurse model system. Jeffrey mentioned Aging and Heartland's work. And in conversations that Alice mentioned earlier with Kaya Ganguly, she's with the state of Vermont. She's a trauma-informed health director, I think. She talked a lot to us about the refugee population and about making materials not just accessible in other languages, because some refugees are completely illiterate, they can't read their own language, but to use images in their messaging and to incorporate like different kinds of food that may be more relevant for different populations in a food shelf. So all of these things are really essential. And if you're interested in participating in this work, you can reach out to me. And my email is masbury@tworivers.org. And then you can go to the next slide for some resources. So these are upcoming. These are not available right now, but I just want to mention briefly some things that are coming this way. So the Upper Valley Resilience Network is based with Vital Communities, and it's a similar structure to the CHIP work group with Mount Ascutney Hospital in that there are many regional partners at the table. They will be dispersing mini grants this year, but these are not rolled out yet. But you can totally reach out to me for more information, and we will also advertise wildly when they become available. And then finally, Mount Ascutney Hospital also has small amounts of money available for food security and health equity work. And again, I don't believe any of that is like publicly available for folks to apply to, but if you email me for more information, I can connect you with folks who know more. And now I'll pass it back to Sarah, who has more concrete information on funding sources.
Awesome. Thank you so much, Megan. It's so exciting to hear about all the food security planning work that's being done in our region now. And there are resources coming down the pike. So please stay tuned. We're going to take a very quick tour through some of the available resources that can support health equity projects in our region. And I just want to preface it by saying this is not a complete accounting of all the help that's available out there. These are just the resources that we're aware of from where we sit in the planning world. And like I said earlier, we're going to open up the floor to discussion after this, and we hope that you'll chime in with additional resources that you know of. We're going to be going through these at a very high level as well, with the goal of sort of giving y'all a mental map of the different doors that you might want to knock on to support the project that you have in mind. And so to help, I'm actually going to stop my share here, to help you dig into the details of these various grant programs. We've prepared a resource document, and I am dropping the link into the chat right now, which has links and also, in some cases, contact information for all of the various grant programs that we're going to be talking about at a very high level in just a few moments. So I'm going to go back to my slide here. Okay, so let's start off with the resources that we have here in-house at Two Rivers. Like all regional planning commissions across the state, Two Rivers has money from the state health department to provide technical assistance for projects that lie at the intersection of health equity and planning or policy work. So if you want to incorporate equity language into your town plan, if you want to revise a bylaw, to better address a specific equity issue. If you are doing a planning study that's focused on a particular topic area or a specific geographic area in your community, for example, a sidewalk connectivity study, or maybe an accessibility study in a particular part of town, we can provide technical assistance for that work. Unfortunately, we cannot use our funding to help you write grant applications. We've gotten the very firm line from the state saying that we're not able to do that, but we might be able to offer you guidance. If you have questions about us, like specific grant application that you're working on, still reach out. We might be able to offer some assistance. We just can't actually write it for you. We can also pay stipends to support the participation of underrepresented populations in that planning and policy work that I was just talking about. So that could mean paying folks to attend community meetings and to share their knowledge and experience at those meetings, or to provide their input and their opinions and their experience through venues other than meetings, like taking surveys or something like that. So if you have a project where you're trying to really broaden participation and support folks who might otherwise have barriers to come to the table, please keep us in mind. Those stipends are a tremendous resource that are often not available in the planning world, I'm sad to say. Our health equity funding runs through May of next year, so that's May of 2024. Also, there are regional and state funds to support communities with environmental assessment of brownfields. For those of you who aren't familiar with the term, a brownfield is a piece of property, it's any piece of property that's either known or suspected to be contaminated and thereby threatening public health, right? And so it could be contamination from an old oil tank that's sitting underground, or maybe the property was used for some sort of manufacturing in the past and there's questions about whether there's contamination left over, or maybe it's just simple like PCBs in the building materials, or lead paint or asbestos or something like that. So the funding, approval, and the assessment process for brownfields are complex and really dependent upon the unique characteristics of the site. So if you're interested in brownfields assessment assistance, please send me an email and I'd be happy to talk through all the details with you, and we'll figure out where you can plug in and how we can support. If we do not have funding in our office to help you with a particular site, we can help you apply for state funding. Speaking of the state, let's turn to state resources. So the Agency of Commerce and Community Development has a Better Places grant program that provides grants to create or revitalize public spaces in or near designated areas like a village center or a downtown. This is a rolling application process, and it's worth noting that there is a significant local match requirement for that project. ACCD also has a community development block grants program that supports municipally led planning and development of facilities and services. And that includes seniors and senior centers and childcare as well. They also have a dedicated grant program for accessibility improvements to town-owned buildings and to libraries. The applications for the community development block grants are rolling, but they do have recommended deadlines, target deadlines, one of which is coming up, I believe, April 11th. There's a 10% in-kind or cash match for those grants. And it is worth noting that the grant administration is kind of a heavy lift for those projects. So we often assist communities with that particular part of a CDBG project with the grant administration. The Agency of Administration's Buildings and General Services Division has a Building Communities Grants program that supports the development of facilities for recreation, education, and the delivery of human services and healthcare. So that particular program also considers major renovation projects, although it does appear that if you wanted to make a sort of major renovation of a recreational facility, that might not be accepted. That might be the one exception to the rule. So if you're in that particular boat, we recommend you reach out to the state program manager and just check on the eligibility of that particular project. But other kinds of facilities for education, human services, healthcare, renovations are totally an eligible use of funding. It's important to note that This particular grant program, they're really looking for shovel-ready projects because it's intended to be sort of last gap funding. So these are for projects where you've already lined up a capital stack, you've already pulled together a whole bunch of other funding, and you just need that last chunk of change to get you over the top to make that project actually happen. There is a one-to-one match requirement for that funding as well. So I just saw that Nizoni is back. Hi, Nizoni, we're so happy to have you back with us. I am going to drop a resource document into the chat again, so that everybody has access to it in case you've come on a little bit later. This resource document, the link that I just put into the chat, includes links and contact information for the various kinds of grant programs that we've been discussing so far. The Vermont Department of Transportation has a whole bunch of grant programs, some of which support projects that increase physical activity and accessibility, and I've listed just a few of those on the screen there. Transportation projects are really complex. They require lots of permitting and coordination between a whole bunch of different people to make it happen. If you're interested in getting a VTrans grant, we strongly recommend that you reach out to Rita Cito in our office. She can help you figure out if a program is a good fit for your community and guide you through the application process. She's brilliant. She's helped so many communities over the years find their way through VTrans's funding programs. So please do reach out to her. In the resource guide, the link that I just dropped in the chat again, we've included a comprehensive guide to VTrans funding programs. So we hope that that's helpful for you. The Department of Forests, Parks and Recreation has a couple of grant programs that support trails and outdoor recreation projects, and they're listed on the screen here. Neither of them is currently accepting applications. But keep an eye on their web pages for more information about the next round of grants. VOREC, we're not sure what the timeline is going to be for that, but the Trails program should be accepting applications in the fall. The VOREC program does not require match, notably, but if you do have match already sort of lined up for your project, it really does help your application. The Trails program requires a 20% match. And it supports new construction of trails, as well as also maintenance and rehabilitation of existing trails as well. And then similar to the services that Two Rivers is offering in-house in terms of technical assistance for health equity planning projects, the state has a technical assistance program that helps communities work on designs and plans that improve public spaces in ways that make our communities more inclusive and healthy. They don't provide direct funding to communities, but they can help with, project design and development, community outreach and engagement, capacity building, and unlike Two Rivers funding, which has the limitation that we can't actually write grant applications for you, the state program can help you write a grant application. So that's really positive. They're accepting applications for technical assistance through the summer. Their service delivery is going to run through October of this year. So if you have a project that you think that's going to extend outside beyond October, maybe come to Two Rivers, because our program runs through May of 2024. So just think about the difference in timelines there. We're always happy to hear from you and talk through your project and figure out how to direct you to the best source of assistance. The state has also started a community ambassador program. So that program is a new initiative where they're hiring affected community members to serve as health equity ambassadors and support the communities that are working with the state on technical assistance projects. And they're looking for folks who are 18 years old and older, who identify as a member of a traditionally underserved community. And that includes BIPOC, that includes LGBTQIA+, rural, persons with disabilities, older adults, and the list goes on. Applicants don't need to have any prior experience to apply to the program. You can get training if you would like training. They're paid $25 an hour up to $1,500 to help out with project planning and community engagement. It's a rolling application process, but we did just hear from the state that that's going to be closing in May. So if you know somebody in your community who might be interested in being a community ambassador, please connect them as soon as possible, because it's a really great opportunity. And then lastly, it's important to note that there are, of course, a great many other state grant programs out there that might be able to support either directly or indirectly a health equity project. And so to learn more, we recommend that you take a look through ACCD's funding directory, which is also linked in that resources document, that Word Google document that I just sent out through the chat link. And then finally, we wanted to note one private resource that we're aware of that's currently accepting applications. I'm sure there are other private resources out there that could be helpful, and we hope that you will chime in with those other resources to share that knowledge in the group discussion that we're going to have in just a minute here. The one that we're aware of is the Vermont Community Foundation's Equitable and Inclusive Communities program. They have grants of up to $10,000 to help municipal governments that are working to build more inclusive and equitable communities. Most of that money is for communities that are already enrolled in the state's IDEAL program, which is like it's a small cohort of communities that have already started equity work in a meaningful way. But the Vermont Community Foundation has reserved some money for communities that are not enrolled in the IDEAL program, and they're accepting applications on a quarterly basis. So that's an opportunity we wanted to make sure everybody was aware of. So that was a whirlwind tour of some of the potential opportunities for funding and support that are out there. And at this point, we wanted to open up the floor again and have a really free-flowing discussion about the work that you all are doing. You've already raised some projects that you're currently working on. We'd love for you to talk in more detail because it's so inspiring and it gives other people ideas for what they can do in their communities. So we'd love to hear about the projects you're working on. Are there any resources or support or collaborations that you're looking for? This is a wonderful space in which to share those. And then any questions you have, either about the stuff we've talked about this evening or about your project, something you're trying to troubleshoot. The goal here is for us to learn from each other and inspire each other as we walk down this road together. So I'm going to stop sharing my screen here so that we can all come back together. Does anybody have any comments?
Sarah, this is Rudy Knight. Emily and I, and probably others on the call, just want to make the group aware of the work of Dartmouth Center for Rural Health Equity. It's sort of getting into its implementation phase. It had a long planning period, and recently it awarded 4 $20,000 pilot project grants. There's a leadership group. There's a community advisory group. It's obviously still sort of in its formative place to some degree, developing sort of the approaches it will use when it thinks about collaborating with the community better. We're just inventing a inquiry form where people could pose ideas or needs to the center and they would be responded to. So I would just say stay tuned. The website right now is actually housed on Dartmouth's main website. You just look up the Center for Rural Health Equity. There's a little 3-minute video that sort of explains the center. But ultimately, it's going to try to become a bit more independent of Dartmouth, and it will have its own website. So I think it has promise. You know, I'm sure there's some trepidation about projects that Dartmouth's undertaken in the past that don't seem to be sustained. This one, I think, has a lot of community interest to hopefully help it sustain itself. So, I don't know if you or others who may be working with Dartmouth want to add anything, but I think it's just another one of those things where there's serendipity, there's synergy, there's opportunity, and I think it maintains some degree of momentum to all this work. So.
Thanks, Rudy.
Hi, my name's Katie, and I just wanted to introduce myself because I am a fairly new employee of the Center for Advancing Rural Health Equity, as I haven't actually met Rudy or Emily yet. But this has been really interesting just to hear about the various processes that you've undertaken to learn about the needs of the community, and also just to helps me kind of get a better understanding of the landscape. I'm fairly new to the area of all the great work that's happening. So it's really exciting, and I feel like I've learned a lot, and there's lots of great ideas sort of percolating just based on the work that's underway in your catchment area. So thanks for inviting me, and I look forward to talking more and collaborating more as we move forward.
Thanks, Katie. Nice to meet you.
Nice to meet you.
Other thoughts? Hey, Alice.
Hi. I think as part of the Vermont Health Disparities Grant, I should certainly mention that there's work going on in the Upper Valley region in the White River Junction district around supporting some community-based equity work, specifically with members of the BIPOC and LGBTQIA+ community. And we've been lucky enough to pull together a steering committee of people who represent marginalized groups in the region. And although one of the real challenges of this process has been that the timeline did not at all match, let's say, what is it? The speed of trust. We've had to work way too fast to make some decisions. And I know that we're going to look back at this in a couple of years and say, oh, geez, here's how we could have done it better. But we're thrilled that we have used the $150,000 allocated to this work to fund 10 different projects that are operating in the Upper Valley region. These range from storytelling projects that we hope will actually deliver a report that can help impact the way healthcare services are delivered to members of our marginalized communities, supporting the development of a new space that is really designed to provide services and supports for members of the BIPOC community, building a new space that will be sort of a collaborative around health and well-being and allow small business people to build out their work. I hope it's okay for me to mention that we're also supporting Nizoni's Safe Spaces for BIPOC and helping her build out the work that she does with that organization. A lot of different projects in all parts of our region, and we're really thrilled by what we've done, and we've also been able to extend these out beyond May 31st of this year to provide folks with a little more time to spend the money that they were awarded. And we look forward to learning from them as they go through this. What I can tell you is a lot of these folks would not really be able to get the kind of traditional grants that those of us who are involved in traditionally white-led and well-established organizations can get. They can't write for Vermont Community Foundation grants yet. They will be able to, but not yet. They can't maybe measure up with some of our more private funding sources against the kinds of outcomes and the kinds of organizational capacity that many of us benefit from having. But that doesn't mean they don't have the capacity to do the work that they know needs to get done. And so finding ways to break through some of our traditional approaches to supporting this work, taking a risk sometimes, or just trusting that people know what work needs to get done is a really important step forward. And we have to figure out a way to continue to do that.
I'm just gonna jump back
Yeah,
in.
please.
Thank you, Alice, for that. And I never mind you talking about safe spaces. On the ride back home after leaving the meeting earlier, I got to thinking about some of the other things I had wanted to kind of touch on, and then hearing about how we can make those connections and what can be done in a kind of an especially non-traditional kind of way through some of this funding that has come my way via what is the term VAVs, the Public Health Council, and this larger pool of money is access to a larger space in which to do things. And one of the things that we're looking at is this very large area in which we have the capacity to in working in collaboration with every town is kind of where the space, space exists in. It's the organization, every town. And so the property that has come to be part of like the space that we can utilize is a very large space, and we were talking about, what can we do for housing needs there? What can we do for health needs there? Holding clinics. It's a large space. It really is such a gift, right? Going beyond just programming and event and fun things, but more in a functional way for our communities to have access to, whether it's vaccine clinics out in the middle of nowhere because it's more accessible, or having a place where we can do health workshops, or hold informational kind of sessions where people can learn how to. I know one of the things with Emily, I believe we were talking about in the last meeting we were in was like Narcan trainings, right? So that these spaces can be there and we can come together as a community and learn how to best serve our communities. So I just want to throw that out there. There's also a space which sometimes can be a deterrent if we don't have the areas in which we can host programs and have people come in and do these things. Those spaces are coming together as well.
That's such exciting news. Are there resources that you're currently looking for the projects that you're working on? This is for the entire group, that you're still trying to figure out, like, how am I going to make that happen? Yeah, Dina.
So I apologize because I feel like I'm sort of all over the map. I wear a lot of different hats, and so my brain is like, okay, so I'm gonna try to focus here. Sorry. It's sort of a resource, not traditionally financial, but I just want to make sure everyone that maybe works in the sort of a community health worker role is aware that Vermont is just starting an association, community health worker association, and there's been a lot of support and great, they're just like writing bylaws and stuff, but we had a big conference. It's good networking, good resources. It's pretty inexpensive to join too. And I don't think you have to necessarily join to access some of the stuff. So Vermont Community Health Workers. So that was one thing I wanted to add in. And the second thing is sort of along that same line, is a community health worker is often defined as someone who's of that neighborhood, right, of that community. And this is where I think what Nozomi was saying is if I, as a white cisgendered person, is going to go out there into my community, who am I going to attract, right? There are people out there that I know I'm not reaching, and I think I think in part it probably has to do with me, who I am as a community health worker going into this community. So I don't really know how to work around that, and I don't know that there's an answer here, but it's along the lines of I serve the town of Sharon, and I know that there are folks out there who identify as BIPOC or LGBTQIA+. I'm not getting them. They're not being referred to me through the community health teams. And, so I'm just, I guess I'm trying to say, how do I help? I need help finding people too that need these services.
Thank you, Dina. Let's toss that out to the group as well to think about that and share your wisdom. Alice, did you have something you want to just respond to directly to Dina's comment?
So it sort of made me think, so I know some of you are familiar with the Junction Youth Center that used to be in White River Junction that Listen closed down in February 2020. It probably would have gotten closed down the next month because of COVID, but Listen closed it down because they decided it no longer fit their mission. And when they did that, all the work that we had done with some state of Vermont funding to help to help the Junction Youth Center build up a community, like a supportive space where they did these social events for LGBTQ kids. And, we got special permission to use the state of Vermont grant funding to get this started. And then the Junction took it on for themselves. But, the first one of those, I went there, because we had to gather data, and there were over 40 kids from towns on both sides of the river. Some of them drove for more than an hour away because they come from towns where maybe they're the only out kid, or maybe they're not even out, right? And so there's no space for those kids. And right now they're under attack in many states. And so they're constantly being bombarded with these negative canceling messages. And, and I'm the parent of somebody who's gay. And so like, I know that, she was lucky enough that she was here when the junction was here, and then she went off to college, and there's now just no space. And the folks from outright Vermont and all that are on the other side of the state. There just isn't a place on this side of the state for kids to go. And I don't know that this group of people can solve that. I just wanted to highlight it as an issue, is that sometimes we build a resource and it's a great resource and it's doing great, and then it's not there anymore. And so it's kind of this constant battle of not just trying to create the infrastructure, but in some cases you create a little bit of infrastructure and then you end up taking 2 steps backward. So I just really wanted to highlight the great need of that community, because I saw those kids and they would like make speeches and like yell, "Thank you, state of Vermont," after we made them fill out the evaluations, because like they're basically at a party and we're making them fill out evaluations. We did use cupcakes as bribes, but we got the most amazing data from those kids, and it just pains me constantly that resource isn't here, and that we could replicate that resource for kids in some of the other towns. So anyway.
Alice, did you want to chime in?
Sure. I just want to piggyback on what Alice was saying. Ditto to what she said about that particular service. One of the things that really concerns me is the inconsistency of so much of the work that we do. Oh, we got this new funding, we can do something for a year or for 3 years, and then it's going to go away. I've been working in the field of public health now for 25 years or so, and I can't tell you how many times I hear people talk about, oh, well, we give people seed money and then they have to find sustainability. Most of the work that we do will never be sustainable without a constant stream of some form of philanthropic or governmental support behind it. And we just have to get beyond this dream we have that somehow, I don't know, we're going to become revenue generators in our nonprofit work. But the other thing that I want to say along with that is there's real harm that gets done when services like that are taken away. It doesn't matter how many times you tell somebody, oh, this is a 3-year grant and we don't know what's going to happen at the end of it. When it's gone, that leaves a hole in somebody's life, in somebody's heart, and it does damage. So we should always be very careful about the things that we start and the ways that we talk about them so that we can reduce that damage, but very much always think about where is the support going to come from this for the long term.
Thank you, Alice. Nazoni?
Piggyback again off of both Alice's. My own children were able to participate in the Youth Junction program, and I saw so many benefits from it. And it was heartbreaking when that shut down. Not only as a parent watching, but for like seeing how it affected my children. And so because of that, with doing what I'm doing with Safe Spaces, I've been trying to set up a youth program, and it has been incredibly difficult so we now have some small funding for it to build the program out. It's it's not much that's allotted to Joel, so I call it Lindaba, and it's actually very difficult trying to find youth to get involved in like how to go about doing that. And I think one of the things I'm looking forward to in meeting with Emily soon, I think next week, is how we can start doing that and get something back in the area for our youth, because it is needed. You look at communities that don't have access, for youth to have access to activities, regardless of if they're marginalized or not. There's a lot of long-term implications in how that affects them, in life. Like it's great for folks who have the money to be able to get their kids involved in certain after-school programs and stuff, but for a lot of folks, that's not a possibility. So I would invite anybody that's on this call or anybody that that would be interested to in collaboration with Growing Out, this youth social club that I'm trying to start through Safe Spaces.
That's so exciting. Thank you for all your incredible work, Ms. Oni.
Thank you.
So I want to create some space for folks to respond directly to these two requests we've heard. One, supporting Ms. Oni's work in terms of outreach to youth in our communities, but then also Dina's request, like how do we make community healthcare services more inclusive? And I see that Katie dropped a very interesting link into the chat around training folks in the community. This is specifically BIPOC folks in the Tufts neighborhood, it sounds like, to become community health workers. Thank you for that resource, Katie. Other thoughts in response to those two requests? Alice.
So, I mean, in the case of the LGBTQ events that we supported at the Junction, we did outreach to all of the schools in the area on both sides of the river. I think M was actually still at Lebanon then. But we reached out to the folks who ran the QSAs, the guidance counselors and people like that, and asked them to help us advertise the events. And then some of it just went out through word of mouth, so that a lot of these kids, the ones who are well off enough to go to camps and things like that, build networks with other kids from their camp days. So, there are some other events out there like, Hanover has done a gay prom and things like that. So like, depending on which group you're looking for, sometimes you can find groups within the school clubs, things like that, that if you can get a hold of the advisor, most of the work was figuring out who the right person was to email at the schools. And then once we did that, they were actually really instrumental in advertising events and things that we were doing. So that's just one. Find those people so you can kind of build a network. And then we turned that contact list over to the Junction when they took over the events on their own.
Thank you, Alice.
I know that we're almost out of time here, Sarah, so I just put something in the chat, which I think is, I just want everybody to kind of know that we're in the process of trying to figure out where HCC fits in, how it continues. And so certainly devastating is the word that I would use to see that teen center dissolve, especially in the way that it did. It was pretty heartbreaking for those kids, especially when adults made promises and they didn't keep them. No, there's not still a youth council because all those kids, this is inevitably what happens. They're all like almost 30 now. And that's lovely. And we want them to still be here and work here and live here, right? However, finding those kids after school and creating spaces for them so that they don't go and do other things or don't go home and be lonely. Jeffrey, I'm so glad that you finally got on here because I think you're hitting the nail on the head for every generation here, that we need to create spaces where we're communicating, connecting, and finding empathy with one another for sure. Thanks for turning the conversation toward things that we have been just all on our brain about. So thanks for doing this. Appreciate it.
Thank you, Em. And that really, and I'm thinking about your comments, everybody's comments too, in relation to building these community spaces and building these community networks. And thinking about your question, Dina, like it feels, just from my personal perspective, that any work we can do to strengthen these community networks and affinity groups and support spaces in our communities is going to benefit how we spread the word about the resources that are available in our community. And it's also going to lift up folks in the community who can reach certain people that others can't, right? So just thinking about like, how do we build up those networks in our communities that already exist, and how do we support other ones? Also thinking about too, like we have incredible communities of holistic medical practice in Vermont, right? And so I know that there's a lot of folks who are training to be midwives, for example, or doulas, and like, it would be so cool. And maybe they already are part of your conversation and your outreach and your networking, but they can help carry messages to the folks who they're interacting with. I know, Alice, you had your hand up for a while. Sorry to keep you waiting.
No, that's fine. I really wanted to just speak to the community health worker idea. Often traditionally when community health workers sort of started to develop as a movement, this was 50 years ago or so, it really was a matter of finding those people within a community who already were influential, who were at the center of the community, who people trusted and went to and said, can we give you a little extra training so that you can do this work at a different level within your own community? So I think we have opportunities as we support the networks of people who are, building out their own structures and their own strength. Use that as an opportunity and ask them, who are the people in your community who are trusted, who are turned to for support and help? And can we find a way to get those people to become part of a network of community health workers? And so sort of take back the community-driven, community-based approach to community health workers. I don't know if there's an organization in the Upper Valley now that is housing community health workers, but if we could get back to something that was a little more like the original concept of that, I suspect whether the Public Health Council could do it, we'd certainly want to be a part of that conversation.
Thanks, Alice. Dina, did you want to reply?
This was more about just that I'm on the board of my library, and we're constantly trying to build space for the teenagers, and like we got snacks to lure them in, and so the libraries might be another good source for finding kids who are looking for those groups, And thank you, Alice, for what you just said about the community health workers.
Thank you, Dina. Nazoni.
Okay, so looking at the community health workers, there was two things. One is I had talked to a gentleman that he's doing, I'm trying to think of what it used to be called. I think it might be the Element Hotel that's over closer to Centera Park. I believe that is being transformed into housing for health workers, travel nurses. I'm not sure how far it will expand out, but that might be something that folks can kind of look into and see if that's something we can tap into. I think that whole building is being transformed into small unit housing specifically for healthcare workers. And then the second thing was, and I forgot to mention earlier, was it's I'm going to mess up the acronym, CROWS, I think, Community Resilience Organization, or Organizers, Community Resilience Organizers. And there is kind of this push for trying to connect with health and wellness providers that are, and for me, it was really hard for me to like unwrap the ideology of like it having to be a doctor or a nurse or a midwife or a yoga, or like looking at how we traditionally look at wellness, but looking outside of that in kind of a bigger spectrum in the ways that we do self-care, whether it's, with our hair, or they try to open it up to be more accessible outside of just kind of institutional health workers. But they're working on something within the Upper Valley right now as well. And Jessica and Ashley Laporte are part of that piece. And I'm not sure if anybody here is familiar with the community resilience organizers stuff that's going on right now. And if not, I would, I'm just going to drop a link in the chat, and I would encourage everybody to just look into it and see if it's something that they might want to connect with as well.
Thank you,
I'm
Ms.
going to find the
Onion.
link first, though.
Yeah, thank you so much. And thank you for sharing your contact information. That's so generous of you. I know we're getting close to the end here. Any final closing parting thoughts folks want to share? Dina?
Yeah, I'm sorry. I don't want to be taking up too much time. This is just something that came to me and I was intrigued by it. I'm kind of curious if it's could be a resource, but the church in Sharon has sort of recognized its own limitations. It's small congregation, and they're actively trying to shift the church into a community space and are looking to see what they can do. And there's been talk about like teen centers or childcare, or, so it's just, I don't know. I don't know if other churches are sort of being that proactive and looking at the problem, but it's just an idea for other folks.
That's really exciting. Thanks for sharing that. Oh, and thank you for that link in zoning. Okay. I want to respect everybody's time here. Any final parting words before we go? Good. Well, thank you all so much for spending time with us this evening. We're just so grateful that you came and you shared your thoughts and your wisdom with us. And you can reach out to myself or to Megan if you'd like more information. Our contact information was on the slides. After we're done with this presentation, I'm going to go ahead and email out to everybody who registered a copy of the slides as well as the resource documents, so you have those ready and handy in case you want to refer back to them. And please don't hesitate to reach out to either of us at any time. We love to chat and hear from you and all the good work that you're doing and see how we can support or make connections. And I'm trying to think if there's anything else. We're also going to post this recording on our YouTube page for the folks who had requested it, who weren't able to make it here this evening. And so they'll be able to access those resources as well. All right. Well, thank you again. I hope you'll have a beautiful evening. Take good care of yourselves. Bye.
Thank you, Sarah.
Thank you.